much for my time. Wakwa in some no the catcher no me de so amount. Kole Clote Marche Bedredi Dr.Zanetor Jaman Rollins wode ade hwede ato ahweye hwapom de ho nsem so adim se wo strata ebeyanka wo munsisi bia ya hodo bia so bi todo bone no montentan de ka no se rehabilitation centers ahodo no a wode nipa na ba akoto atete no atenetene no na se ndu bone na free ni nipadum no ho mfaso e wo so se oba abrabo kan ye adwuma so moman no na se koba so obi de sa ana wonum bi na ne bone fosem wuram ne esa do mukose prison beba no
We're seeing a huge number of people who are on illicit drugs, but we're not seeing enough facilities that can provide the necessary rehabilitation for a lot of these persons. You know, most of them are private, a lot of them are too expensive, and the ones that are the state-owned are usually so full that it's difficult to get some of these people in. We need to actually look at more community-based centers for drug rehabilitation because it's really become a serious problem, and it's starting to show more and more in various age groups, from the youth to a lot of older people as well. Usually what happens is most people assume that when you have an infection you start away with antibiotics, but it's not always the case. Sometimes the cause of an infection could be viral, it could be fungal, in which case there are specific things that you need to use. And mostly the problem with the overuse of antibiotics or the abuse of antibiotics, as it said, is that you end up with the population developing a resistance to the particular antibiotic, which means that the strains of various bacteria that could otherwise be treated are difficult to treat because now they're resistant to antibiotics. So now you have to do combination therapy, and sometimes you have to look for different types of antibiotics as well, which might be more expensive. So by and large, usually if it's a mild infection, if one does not need to prescribe antibiotics, that's the case. And usually the best is to actually see a medical practitioner who can actually take the decision to prescribe or not.